When you think of a surgeon, you probably picture steady hands and a sharp scalpel, right? But that's honestly just a tiny part of the story. The real work is happening inside their head. It's about solving one intense, high-stakes, intellectual puzzle after another, especially when the human body is pushed to its absolute limit. So, let's dive into what that really looks like.
Here's our game plan. We're going to take a journey deep inside the body when it's in crisis. We'll start with its incredibly delicate chemical balance, then look at how it tries to heal itself. We'll see what happens when things go wrong, explore the most extreme solutions, and by the end, you'll have a much better idea of how surgeons actually think.
Okay, so long before a single cut is made, a surgeon has to be totally fluent in the body's secret language. And I'm talking about homeostasis, that constant, invisible chemical balancing act that's happening inside you right now, keeping you alive. Believe it or not, it's a language written entirely in numbers.
So, let's put you in the surgeon's shoes for a second. Your patient had brain surgery a few days ago, but now they're just not right. They're sluggish and their hands are flapping uncontrollably. You get their lab work back. How do you find the one tiny clue in those numbers that's going to save their life?
The clue is right here, 118. That's the patient's sodium level, and it is dangerously low. Now, this single number, it tells a whole story. It tells the surgeon that the patient was getting the wrong IV fluid, basically just sugar water, which was diluting all the salt in their body and causing those scary neurological symptoms. The solution isn't some complex new operation, it's as simple as just changing the IV bag.
And this table shows you exactly why that's so critical. Every single fluid in our body, from your saliva to your stomach acid, has its own unique chemical fingerprint. So if a patient is losing a ton of fluid from their stomach, you can't just pump them full of any old solution. You have to match that specific recipe, or you risk throwing their entire system into complete chaos.
Which brings up a crucial point. So many surgical decisions are really just about buying time. Let's say a patient has dangerously high potassium levels, something that can literally stop their heart. You've got two main choices. You can give drugs like insulin, which actually lower the potassium in the blood, or you can give calcium gluconate. Now, the calcium doesn't fix the problem. It doesn't lower the potassium at all. What it does is act like a shield, protecting the heart from potassium's deadly effects. It's a temporary fix that prevents an immediate catastrophe, and that gives the surgeon the time they need to figure out and treat the real problem.
So once that immediate crisis is over and the surgery is done, an even more incredible process starts to kick in: healing. The body literally becomes its own construction site, working around the clock to rebuild everything that was damaged.
Healing basically happens in three big phases. First up is inflammation. Think of this as the demolition crew. Cells like neutrophils rush in to clear out all the bacteria and debris. Then comes proliferation. This is when the construction workers, called fibroblasts, show up to lay down a scaffold of new, kind of weak collagen and build new blood vessels. And finally, you get remodeling. Over months, or even up to a year, that weak scaffold gets replaced with much stronger collagen, making the repair permanent.
But, okay, what happens when the thing you're repairing isn't just a simple wall, but a complex piece of machinery? Take a look at this hand. Repairing tendons isn't as simple as just patching a hole. Here, the very process of healing can actually become the enemy.
Surgeons have a grim name for this problem area: no man's land. It's this tiny little tunnel in your finger where tendons need to glide perfectly. The problem is, as a tendon heals, it forms scar tissue that can stick to the walls of that tunnel, basically gluing the whole thing in place. So the surgeon is walking this impossible tightrope. They have to keep the hand still enough for the tendon to heal, but start moving it early enough to stop those crippling adhesions from forming.
And this kind of proactive, forward thinking is everywhere in surgery. They even classify wounds before an infection has any chance to start. An elective gallbladder removal, for example, is called a clean, contaminated wound. Why? Well, because you're entering the gut, which is full of bacteria, but there's no active infection going on. That simple classification helps predict the risk and tells the surgeon whether they should use preventative antibiotics. It's all about staying one step ahead.
But even with the most perfect plan and flawless execution, the body can throw some serious curveballs. The time after surgery is like a minefield of potential problems, where a treatment that saves a patient from one thing can accidentally trigger something else just as bad.
200,000. Just let that number sink in. That's roughly how many deaths happen in the United States every single year from a pulmonary embolism. That's a blood clot that travels to the lungs. And it is one of the biggest dangers lurking for patients after an operation.
And surgeons are hyper-aware of this because the risk factors are so incredibly common in their patients. Just being over 40, having cancer, or even just being stuck in bed for a while. All of these things dramatically increase the chances of a clot forming deep in the veins at the legs.
So get ready for this nightmare scenario. A woman has surgery for cancer. 5 days later, a massive clot hits her lungs. To save her life, she's put on the blood thinner heparin. But 3 days after that, the heparin causes a catastrophic internal bleed. You're the surgeon. If you stop the heparin, the clot will probably kill her. If you don't, she could bleed to death. What do you do?
The solution is this incredibly elegant, beautiful balancing act. You do two things at once. First, you place a tiny umbrella-shaped filter in the body's main vein, the vena cava, to physically catch any new clots before they can get to the lungs. At the exact same time, you give a different drug that instantly reverses the heparin, which lets her body form clots again and stop the bleeding. It's just a perfect example of navigating two competing, life-threatening crises.
Sometimes, though, the damage is just too great. Repair isn't an option. Sometimes, you need the ultimate replacement, a brand new organ. And that brings us to the world of transplantation, probably the most complex surgical intervention there is. Let's just take kidney failure. A patient can absolutely be kept alive on dialysis, where a machine cleans their blood. But compare that to a transplant. After just 2 years, a transplant is actually cheaper. But way more important than that, it dramatically improves a person's quality of life. The new kidney produces hormones that prevent anemia, patients can get back to their normal lives, and women even have much higher rates of successful pregnancies. A transplant gives you your life back.
But here is the great paradox of transplantation. The incredible technical skill of sewing in a new organ, that's not the hardest part. The real challenge starts the second the clamps come off and blood flows into that new organ. A successful surgery is really just the opening bell for a lifelong battle against the patient's own immune system, which is hardwired to identify and destroy this life-saving foreign object.
And this is where medical science gets just unbelievably clever. Drugs like cyclosporin were an absolute game-changer because they found a tiny chink in the immune system's armor. See, cyclosporin works by blocking one very specific chemical signal called interleukin-2. Without that signal, the body's killer T cells never get the go command to attack the new organ. It doesn't wipe out the whole immune system, it just silences one crucial conversation, essentially tricking the body into accepting its new part.
So, as we've seen, from decoding electrolyte numbers to completely outsmarting the immune system, surgery is just so much more than what happens in the OR. At its very core, it's about making this relentless series of critical decisions, all under immense pressure and with a ton of uncertainty.
It really is a series of high-stakes calculations. Every single choice, from which IV fluid to hang to when you start physical therapy, is all about balancing one risk against another, constantly recalculating the odds to find the safest possible path back to health for that one person.
And here's the last thing I want to leave you with. All of the information that we've just gone through, it all came from a single source, a book that surgeons use to study for their board exams. It's not just a list of facts they have to memorize. It's a collection of puzzles and paradoxes and impossible choices. So what does it tell us that this is the knowledge required, not just to operate, but just to be able to think like a surgeon? It reveals this whole world of hidden complexity, both inside our own bodies and inside the minds of the people we trust to put them back together.